this is Dr. Schoor. I'm going to talk a little bit about vasectomies. Vasectomies are office-based procedures. They take about 15 minutes in the skilled hands, and they should be entirely painless. I do what's called a no-needle, no-scalpel vasectomy. Let me tell you a little bit about why I do the no-needle approach. Needles hurt. Lidocaine stings and burns. Instead of using a needle with a lot of lidocaine for a lot of stinging and burning, I use a specialized jet injector which injects 0.1 cc's of lidocaine in the skin and the vas deferens rather than a traditional needle approach which injects 5 to 10 cc's of lidocaine in this area. So not only do you not have the injection, you don't have all the stinging and burning from the traditional lidocaine and needle approach. The vasectomy itself is very straightforward. Once the skin and the vas is numb, with a no-needle instrument, I spread open the skin along its natural skin lines. This allows for less bleeding and very quick healing. Then I spread along the side of the vas, use a special clamp called a ring clamp or vas clamp to pull the vas up into the surgical field. I make an opening in the sheath of the vas, which is the muscular covering surrounding the vas deferens, and pull up the vas, snip, snip, burn, dunk, tie. It takes about as long to say it as it does to actually do it. Each side takes about 8 to 10 minutes for a total of 15 to 20 minutes of the procedure itself. Men can expect minimal discomfort afterwards, minimal swelling, a little bit of black and blue perhaps, a little bit of bruising. Every so often get a separation of the skin, which does not need any other treatment other than waiting for it to close up. Very few men will require any antibiotics afterwards. No men require antibiotics before or during the procedure. It's a very safe and effective procedure. The major risks of the procedure are that every so often the two ends can reattach or recanalize. This is very, very unusual. It happens about 1 in 1,000 times. It has, in fact, happened to me over the years because I do so many of these procedures. When that does happen, if the sperm count does not go down to 0 ever, occasionally we have to go and redo the procedure. But again, this is very, very rare. Most of the time, patients come back to me 4 months after the procedure and they are cleared for unprotected intercourse. There's no change in the amount of ejaculate fluid that comes out and no sexual side effects whatsoever. No change in the quality or pleasurable experience of the orgasm or ejaculation. If you have any questions, please feel free to contact me, and I look forward to seeing you. Thanks a lot.